All right, let's scrub in and dive deep into the world of anesthetic technicians.
Sounds good to me.
Specifically, how to absolutely crush that interview.
Right.
We've got some really great resources to pull from for this deep dive. A career guide, an interview guide, and even a glimpse into RoleCatcher's AI.
Excellent.
But we're not going to just summarize them. We're going to pull out the best stuff, the stuff that will actually help you stand out.
I like it.
So before we get into the questions, can you maybe set the scene a little bit? The career guide talks about an anesthetic technician's role as being super hands-on.
Yes, absolutely. I mean, just imagine you're in the OR,
The heart of the action.
Yeah.
Everything has to be perfect.
Every piece of equipment calibrated. You're anticipating the specialized doctor's needs, basically an extension of their expertise.
Oh, wow.
Absolutely.
And it's not just about technical skills.
No, no, no.
The guide also mentions the emotional demands of this kind of role.
Right. You're working with patients when they're at their most vulnerable, often in critical situations. So those interviewing you are going to be looking for someone with both precision and compassion.
It's a tough job.
It is.
Okay, so let's jump into some questions.
Sounds good.
The interview guide that we have lists 9 questions, but we're only going to focus on the ones that really give you a chance to show off.
All right. So, which ones?
So first up,
Okay.
can you describe a time when you had to work collaboratively with the surgical team to ensure patient safety? This is like the classic teamwork question, but with life and death stakes.
Right, exactly. This is where you need to have a compelling story. Something that shows off your ability to communicate clearly, solve problems quickly, and stay calm under pressure. Think back to a specific situation, like maybe a sudden change in a patient's vitals or an unexpected equipment malfunction.
Right. Those are the best stories.
Yeah.
And don't just tell the story. Make them feel it. Describe the tension in the room, the quick decisions that had to be made. Did you anticipate a problem before it even happened? Did you clearly communicate that critical piece of information? Remember, interviewers want to see what you did, but they also want to know how you think, how you react under pressure.
Oh, for sure. For sure. And this is actually where I think RoleCatcher's AI could be super useful.
Really?
Yeah. Let's say you've got this great story about how you collaborated with the surgical team to, I don't know, stabilize a patient's blood pressure during a procedure. RoleCatcher can help you actually tailor your answer to highlight the specific skills that the employer is looking for. Did they mention, critical thinking or adaptability in the job description?
Okay, yeah.
Well, RoleCatcher will weave those keywords into your response.
So it's like having your own personal script editor.
Exactly.
Okay. Moving on to the next one. How do you handle emergency situations during anesthesia administration?
Oh, my goodness.
High stakes. This is about thinking on your feet and remaining calm. They want to know that you can assess the situation quickly, that you know the protocols, and that you can make the right decisions even when things get really intense.
Absolutely. So again, think of a specific example. Maybe a patient had an allergic reaction, or maybe there was a sudden drop in oxygen saturation. What did you do? How did you help resolve the situation? Did you take any actions that went above and beyond? And don't just say what you did, Tell them what you were thinking, how you prioritized tasks, how you communicated with the team. Let them see that problem-solving process in action.
Yeah, that's important.
Yeah. And remember, even if things didn't turn out perfectly, you can still demonstrate what you learned and how you applied that knowledge going forward.
That's a good point.
Shows that you're not just technically proficient, You're reflective, and you're always learning and growing.
Always learning. Okay, question number 3. How do you stay up to date with the latest developments in anesthesia technology and techniques? I mean, medicine is always changing, right?
Mm-hmm.
How do you show that you're on top of it?
It's definitely not enough to just say that you read journals or go to conferences. You have to be specific. Mention some recent advancements that have caught your eye.
Yeah.
For example, the career guide mentions that ultrasound-guided regional anesthesia is being used more and more.
Oh, yeah. I've heard of that.
Have you been following the research, maybe taken some courses? Sharing specific examples like that shows you're genuinely interested in staying ahead of the curve.
Yeah, you're not just passively reading stuff.
Right. You're actively looking for ways to improve.
That's so important. And actually, this is another area where RoleCatcher can be really helpful.
Oh, yeah. Tell me more.
It can analyze job descriptions and figure out which skills and knowledge are most in demand.
For that specific role. I like it.
Let's say the job posting mentions experience with PCA pumps.
Okay.
RoleCatcher will point that out
Mm-hmm.
and suggest that you talk about any relevant training or experience that you have in that area.
That's a great feature.
Yeah, and just make sure your answers is exactly what the employer is looking for.
I like it.
Okay, so this next question, this one is all about soft skills. How do you communicate with patients before and after surgery? It's easy to just say, I'm a good communicator, but how do you prove it?
Well, you give concrete examples. Describe how you explain these complex medical procedures to patients in a way that's easy to understand. Maybe you use analogies or draw pictures, Do you have any go-to phrases that you use to calm people down? Share those.
Those are good.
Yeah.
And what about communicating after surgery? How do you give clear instructions for recovery? How do you make sure patients understand their medications and any potential side effects? Do you have a system for checking in with patients after they've been discharged?
That's important too.
Yeah.
I mean, remember, you're not just treating a condition, you're caring for a human being. And interviewers want to know that you understand that emotional and psychological side of patient care.
That makes sense. Okay, let's do another one. This one focuses on technical skills. Can you describe your experience working with different types of anesthesia equipment? This is your chance to show off your knowledge of things like ventilators, anesthesia machines, monitoring systems, all that complex stuff that keeps patients safe during surgery.
And don't just name drop equipment. Talk about your proficiency with each piece. Can you troubleshoot issues? Do you understand how different models work? Have you had any special training?
And the career guide has a great tip.
Mm-hmm.
Highlight any certifications you have that are relevant to specific equipment. It just proves your point and shows that you are dedicated to professional development.
Right. Certifications like ACLS or PLS, for example,
Yes.
those show a deeper level of expertise, and they can really help you stand out.
Absolutely. Okay, let's move on to a question that digs into your understanding of infection control procedures. How do you maintain a sterile environment during surgery? Attention to detail is absolutely critical here.
It is. You really want to demonstrate a thorough understanding of the protocols here. Everything from wearing sterile gowns and gloves to how you handle instruments and how you prep the surgical site, walk them through your routine. Like how do you make sure everything is meticulously clean and
So it's
organized?
detail-oriented.
Yeah. And don't be afraid to go beyond the basics. Maybe you've implemented some new strategies for improving sterility in your previous roles, or you're always looking for ways to optimize protocols.
Always striving to do better.
Absolutely. Showing initiative is key here. It shows that you're not just following the rules, you're genuinely invested in patient safety and always looking for ways to improve.
Okay, we've covered quite a few questions already,
Yeah.
but there's one more that I want to hit in this section. Can you explain your experience with administering anesthesia? This might seem pretty straightforward, but it's actually your chance to showcase both your technical knowledge and your ability to tailor your response to the specific role that you're interviewing for.
So don't just give them a list of every single procedure you've been involved in.
Right.
You want to focus on the experiences that are most relevant to the job you're applying for. Think about the types of anesthesia they use, the types of patients they see, and how complex the cases are that they handle.
So if it's a specialized cardiac center, you'd want to talk about any cardiac anesthesia experience that you have.
Exactly. And
Yeah.
be specific.
Yeah.
Like mention the types of anesthetics you've administered, the monitoring techniques that you're familiar with, and any specialized equipment that you've used.
So basically you want to show that you can jump right in.
You got it. And before we move on, let's talk about RoleCatcher again for a second. Remember how we talked about tailoring your answers to the specific job?
Yes.
Well, RoleCatcher can help you do that.
It's like having a personal interview coach in your pocket. You can actually practice your answers with it, and it gives you feedback on your content, your delivery, and even your body language.
Really?
Yeah, it's amazing.
Wow, that's incredible. It's a fantastic resource for improving your interview skills and boosting your confidence.
Absolutely.
All right, so we've tackled some of the interview questions and talked about how RoleCatcher can help you prepare. But landing your dream job isn't just about acing the interview.
It's not.
No, there's more to it than that. So stay tuned, because next we're going to be diving into some career insights and strategies that can help you stand out in the job market.
Ooh, exciting.
I know, right?
Okay, so stay tuned.
Sounds good. Welcome back. So we've covered some of those tough interview questions,
We have.
but let's talk about what happens after you get the job. Your career as an anesthetic technician.
Okay, yeah. It's not just about getting hired. It's about actually building a career.
Right, exactly. So what kind of insights does the career guide give us on that?
Yeah, what does it say?
Well, one thing that jumps out is specialization.
Oh, interesting.
As you gain experience, you can really focus in on specific areas of anesthesia.
Like what? What kind of areas?
Well, like cardiac, pediatric, or neuro, for example.
So you could become the go-to person for, like, really complex spinal surgery.
Exactly. Or you could be that calming presence that puts kids at ease before they go under.
That's amazing. So many options.
So it's like choosing your own adventure, you know?
I like it.
Yeah. And the guide also mentions getting advanced certifications.
Oh, right. Like what?
Well, things like becoming a certified anesthetic technician,
Okay.
a CCAT.
A cat.
Yeah. It shows that you're an expert, but it can also open doors to leadership roles
Oh, wow.
and potentially higher pay, too.
That makes sense.
I mean, think about it. You could be managing other technicians, mentoring new hires, or even leading quality improvement projects.
So you're not just stuck in one role forever.
No, not at all. There's room to grow and evolve in this profession.
I like that.
Me too.
Speaking of growth, what's the job outlook like for anesthetic technicians these days?
It's actually really positive. The career guide says it's projected to grow by 7% over the next decade.
Wow. That's a lot faster than average, right?
Much faster.
So there's going to be a growing need for skilled professionals like our listeners.
Exactly. It's great news if you're thinking about this career path, but it also means that there's going to be competition.
Oh, yeah. Good point.
Yeah. So how can aspiring anesthetic technicians really make themselves stand out?
That's the question.
It really starts with building a strong foundation, I think.
Like how?
Focus on getting hands-on experience, through internships or part-time jobs in hospitals or clinics.
Okay.
Shadow experienced technicians, ask them lots of questions, absorb as much knowledge as you can.
The more experience you have, the more confident you'll be.
Exactly.
And I bet those experiences would give you some awesome stories to tell during interviews.
Oh, for sure.
Okay, speaking of interviews, let's jump back into some more of those questions. This next one is all about critical thinking. How do you manage a patient's pain during surgery?
Right. So this question is where you show off your understanding of the science of pain and how to adjust your approach for each individual patient. I mean, pain is subjective.
Yeah, that's true.
Everyone responds differently to medications and treatments.
Right.
So it's not just about knowing which button to push. It's about really assessing their needs, monitoring their vital signs, and making changes to the pain management plan as you go.
You have to be adaptable.
Exactly. You also want to show off your knowledge of different pain management techniques, like local anesthetics, opioids, nerve blocks.
There's so many options.
There are. Why would you choose one over another? What are the potential side effects? How do you make sure the patient is comfortable throughout the whole thing?
Those are really good points. And this is another area where staying current on the latest research and techniques is super important. The career guide mentions that there's a growing focus on multimodal pain management.
Oh, interesting. Tell me more.
Basically, it combines different approaches to minimize side effects and make things more effective.
I see. So have you been to any conferences on this topic? Read any articles? Sharing that kind of stuff shows the interviewer that you're not just following the textbook,
Right. You're actively trying to improve patient care.
Exactly.
Okay. So this next question is one that a lot of people get nervous about. Can you describe a time when you had to work with the surgical team to ensure patient safety?
Oh, yeah. That one can feel high pressure.
It can.
But it's a chance for you to shine as a team player.
Okay. How?
The key is to choose a situation that shows off your skills. Maybe you noticed a mistake on the patient's medication list, or a problem with some equipment.
Oh, I see.
How did you communicate your concerns? What did you do to make sure the patient stayed safe?
And it's not about blaming anyone, right?
No, not at all. It's about showing the importance of teamwork, clear communication, and keeping the patient's well-being at the forefront.
Right. So did you really listen to what your colleagues had to say? Did you offer helpful solutions? Did you advocate for the patient?
Exactly. The interviewer wants to see that you can work well with others even when things get tough. And this is where RoleCatcher can be really cool.
Oh, yeah. How so?
Imagine you're using it to practice this answer. You've described the situation, what you did, and the outcome.
Okay.
But RoleCatcher notices something.
What's that?
You've used I a lot. It suggests changing some of the wording to emphasize we in the team. you know?
Oh, that's a good catch.
It shifts the focus from individual actions to a collective effort.
Those little details can make a big difference.
For sure. Speaking of how you come across, here's another question. How do you handle stress and stay composed in high-pressure situations?
That's a good one.
It's not enough to just say, oh, I'm a calm person.
Right.
You need to show them that you have strategies for managing stress. Like what?
Well, do you have any go-to techniques for staying focused when things get crazy?
Like taking deep breaths or picturing something peaceful?
Exactly.
Yeah.
Maybe you repeat a positive mantra to yourself. Whatever it is, tell them about it. It shows self-awareness and that you can maintain professionalism even under pressure.
And you can connect it back to your passion for the field.
Exactly.
Yeah.
You can say that you know the OR is a stressful environment, but your commitment to patient safety and the surgical team motivates you to stay calm and focused, even when unexpected things happen.
Yeah, turn that potential weakness into a strength.
Right. Okay, one more question for this section.
That's good.
How do you stay up to date on the latest stuff in anesthesia?
Okay, we talked about this a little bit already.
We did, but let's go deeper.
Okay.
Go beyond just mentioning journals and conferences. Be specific.
What breakthroughs in anesthesia have really caught your attention lately? Have you taken any extra courses? Or maybe gone for additional certifications, like that Certified Anaesthetic Technician credential from the Career Guide?
The CAT.
Yes.
Those are all really good points.
Mm-hmm.
And it's not just about getting the knowledge, right? It's about using it.
Right.
So how have you put new techniques into practice? Have you done any research or presented at conferences?
Those are the things that make you stand out. It shows that you're dedicated.
And speaking of staying ahead of the game, don't forget about RoleCatcher.
Oh, right.
It's not just for practicing your answers. It can also help you spot industry trends and learn about new technology.
And tailor your professional development.
Yeah.
So cool.
Yeah, it's like your personalized guide for navigating the anesthesia world.
I love it.
So we've talked about career paths, covered some more interview questions, and even touched on how technology can give you an edge. But before we wrap up this whole deep dive, there's one more really important thing we need to talk about.
Okay. What's that?
Confidence. So we've talked about having the right skills and experience, and we've even talked about using AI tools like RoleCatcher. But let's be honest, confidence is key.
It really is.
You can have all the knowledge in the world, but if you can't project confidence, it's not going to matter.
Confidence is what makes your answers stand out.
And it shows the interviewer that you truly believe in yourself.
Absolutely.
And confidence comes from knowing your stuff, which we've already covered. But it also comes from practice.
Lots of practice.
So instead of memorizing a script, just try to understand the main ideas.
Right.
And be able to talk about your experiences in a way that's clear, concise, and interesting.
It should feel like a conversation.
Exactly.
Yeah.
And the interview guide actually has a few more questions that we haven't gotten to yet.
Oh, perfect.
And they're great for practicing that conversational approach.
Okay, I like it. What's the first one?
All right, so this is a classic. What are your strengths and weaknesses as an anesthetic technician?
Ooh, that one can feel a bit tricky.
It can. It can feel like a trap.
Yeah.
But it's really an opportunity to show that you're self-aware.
And that you're always trying to improve.
Exactly. So when you're talking about your strengths, be specific. Give examples.
Don't just say, I'm detail-oriented.
Right. Tell them about a time when your attention to detail actually prevented a medication error.
Perfect example.
And when you're talking about weaknesses, choose something that you're actively working on.
Yeah.
Maybe you're a little shy in groups, but you've been pushing yourself to speak up more in meetings.
It shows that you're not afraid to admit where you can grow.
Exactly. Okay, let's do another one. Describe a challenging situation you faced in the operating room and how you handled it.
All right, so problem solving.
Yes. This is where you show them how you think on your feet. So pick a situation that really put your skills to the test.
Okay.
Like maybe a piece of equipment suddenly stopped working. Or a patient's condition changed unexpectedly.
High-pressure situations.
Walk them through your thought process. How did you figure out what was going on? What did you do? Who did you talk to? What was the result?
Really paint a picture for them.
And here's a tip. Talk about what you learned. Even if things didn't go perfectly, what did you take away from that experience? How did it make you better?
Showing that you learn from your mistakes is important.
It is. It shows that you're always growing. Okay, last question. Where do you see yourself in 5 years?
Okay, so thinking about the future.
This isn't about having your whole life planned out.
Right.
It's about showing that you're ambitious and that you want to keep learning and growing in this field.
Okay.
So do you see yourself specializing in a certain area, maybe taking on a leadership role, contributing to research.
It's all about having goals.
Share your aspirations with them,
Yeah.
but make sure they're realistic and that they align with the organization's goals.
So if the hospital has a big focus on cardiac care and you love cardiac anesthesia, that's a great thing to point out.
It shows that you've done your research.
You've done?
Wow, we've really covered a lot in this deep dive.
We have.
We talked about what it means to be an anesthetic technician, tackled some tough interview questions, and even explored career paths and how to use technology to your advantage.
And don't forget about confidence.
That's right. So remember, prepare, practice your answers, and believe in yourself. You've got this.
Best of luck on your journey. We know you'll do great.
That's it for this episode of The Deep Dive. Thanks for joining us. See you next time for another fascinating exploration.